Always great to talk to our next guest, a fan favorite here on the MegaCast, our good old friend, Dr. Taweel, over at the Grand River Medical Associates. Great to have you with us here.
How's everybody doing? It's been a bit.
Yes.
You know, you are a fan favorite. You're like yes. Our family doctor without being a part of our family.
Oh, no, you guys are family to me.
Oh, please.
I really think of myself as a fan favorite, but thank you.
So, but when I think about you, every time I hear a headline, I hear your voice in my head, like talking about some of these issues that we talk about, which the thing I love about the show is we can talk to people at length to let people understand and know what people, the questions that we have are pretty much the questions that come from the public, right? So one of the latest that came out has to do with double masking. And we're all confused. We're 11 months into this. Now you're telling me to double mask? In the beginning, you were telling me not to mask at all. Now you're telling me to double mask? I am so confused.
Well, anything you can do to try and reduce the risk as best as possible. Obviously, double masking is going to be better than single masking, so it's going to be something I am going to recommend. But I mean, let's be frank, I can be frustrating. People wearing cloth masks, months ago, and people, it's been a lot, and it seems like every time we're just about to get to something, it just, next thing you know, they end up asking for something else, and oh man, I see the fatigue setting in with everybody.
The fatigue, but also when you're a doctor and you have to answer these questions all day long.
It's adding to my schedule. It's no longer like a simple day of patients. What it is, if you come in with like a urine infection, it's now a urine infection with a bunch of COVID questions on top of it. So it just kind of stretches things out a little bit.
Right, and when your time is so valuable as well, and that can add to it. But we're also
these interviews can help mitigate some of that, if anything.
And that's one of the things we hope to say to people. No, here's what you can do, so that you don't have to go to your primary care doctor and ask them the exact same questions that we're asking. This is what someone with the letters behind their names that you can answer and we can't. But with that too, it's like we're going in, and the big question is about the vaccine. If I've had the vaccine, why do I still have to wear a mask?
Well, because the vaccine, while it does help you if you were to get COVID, it will definitely make it a less severe case. It'll be a case that you most likely, hopefully, would be able to handle. But it does not prevent you from still spreading it. So a mask is still going to be very important, even if you have received the vaccine. You want to make sure that you're not going to continue to spread this. The herd immunity thing will happen, but we need to get enough people vaccinated. And so until then, please continue to wear the mask. Despite the fact that a lot of people have received the vaccine, we still have a significant amount of people that have not gotten it yet. So, continuing to wear the mask is always going to be the best thing for this point in time, and I'm going to encourage it as much as I can, despite the fact I absolutely hate wearing the mask. So, but I will do it under duress, but I have to. And there's nothing around that.
Hey, at least you're a guy, because you don't have to worry about it. It wipes off your makeup, like your lipstick, but also like I have a really long nose. Like I want to get a nose job, but that's like a story for another day, right? But because of the shape of my nose, like the makeup, because of the mask, wears it all off. And then it's like my nose looks bigger because it doesn't have makeup on.
Well, sorry about that. Plus you got glasses. That's like the worst combo on the planet. The glasses fog.
It's the worst.
Right? I'm double doomed here.
Walk outside.
It's a mess. It's a mess. The beard does not make it any better. I mean, it pulls the mask off of my face as I talk. And it shreds the inside of the paper mask, so it starts to tickle my face, and it's never fun, and I hate every minute of it, but I'm doing my part, and I encourage everyone else to do the same.
So one of the things we are also hearing is about the fact that it's just that if you're getting the vaccine, I've known so many people that have been able to qualify because they're first responders, and they're like, I'm getting it more for the person who's the small business owner, because I want them to be able to get back to where they are. So I'm not doing a vaccine so much for myself, I'm doing it for my community. I'm doing it for the other people, to help us get back to where we once lived. as a doctor, what are the common questions that you're getting every day other than where can I get the vaccine?
Yeah. Common questions. Where can I get it? Can you write me a letter? Things like that. But the big questions that, and remember, I do like that statement that you're doing it to kind of get things back in action, because ultimately vaccines are a community thing and it's for the betterment of the community ultimately. The common questions I always get, first and foremost, should I get it?
Yeah.
And I'm always going to say yes. And I believe it's going to be safe. I believe it to be effective, and I think it's going to help. So I do recommend it. Absolutely. I'm also not going to harass patients, though. I'm gonna. People are educated. It's up to them to make a good decision. I will try my hardest to assuage any of their concerns that it is dangerous. I mean, there can be allergic reactions. There's not been a lot. People have been tolerating it well. They don't. So which leads to the second question, which is how did you feel when you got it? What should I expect? You're going to expect some soreness at the site that you got the injection. That's, you get injected, you're going to have a localized reaction that's going to cause some inflammation. It will be tender for a bit, not much unlike any other vaccine you would have received. And some people do experience flu-like symptoms for a couple of days that just make them feel pretty wiped out. You will not get COVID from the vaccine. You will have a reaction. That's what is to be expected. It is working when it's doing that. But you might feel a little wiped out for a day or two.
From what we're hearing, most people are having a more severe reaction to the second dose, more so than the first.
Yeah, and same thing happened with me when I got my second dose. I was pretty lethargic for a day. I slept it off, back to business the next day.
Why is that?
I imagine it's because the second dose is really kicking that immunity into high gear. First dose is kind of starting, your body is having that response, creating the antibodies to it. And I think the second dose is actually just boosting that up, and you're getting a little bit more, your body is creating more antibodies, and you're having that immune response that you want to have happen so that your body can be prepared for it when the real thing comes along.
So I saw an interview recently with Chris Rock, and he said, I don't know what's in the vaccine, but do I care? It's like Tylenol. I don't know what's in Tylenol, but I know it gets rid of my headache, so I'm going to take it. Yeah. Get the vaccine.
Exactly. Most people don't even know what's in a hot dog, but they're eating them.
That you do not want to know. But do you feel like when you have some of these public people come out and talk about the vaccine, it helps bridge that gap from people who are a little bit leery? Because I will say, I still don't get the flu vaccine. And I will say, I have worked in certain news organizations. It's almost like they're pushing it. Like they have the person who comes in, and then they keep track, and they will call you and text you. You didn't get your flu vaccine. Where's your flu? You didn't get it. I don't get it. I don't get it. I'm not putting the flu in my body. I don't want it. If I get sick, I get sick. I have sick pay. That's what it's for. But it's almost like there's pressure to get it from some of these organizations. And that's just the flu vaccine before COVID. So I can imagine what's going to happen after this point.
Yeah, I think, there's always going to be people that don't want to take the vaccine. And again, it's a free country. This is part of what we do. And my job is to just educate you and give you my experience based on the data, based on what I know, and based on what I can tell you, and hope that you'll make a decision that's going to be within your own best interests. And fortunately, I can't tell you what's in your best interest. That's a personal decision. I can tell you what I think is in your best interest, but ultimately you're going to have to make that decision.
I think one of the hard things, Dr. Taweel, for so many people is when it comes to the questions of what about the long-term side effects? We don't know. What about this? We don't know. I mean, we still haven't gotten the accuracy of the testing down, and now we're in the middle of a vaccine. So I think the way this whole thing has been rolled out, you can kind of understand people's hesitancy into getting the vaccine.
I certainly can. And, it's one of those things that always happens when you're dealing with a problem as the problem is happening, as opposed to preparing for a problem that has not happened yet. The thing that's to bear in mind is that the method in which, I'm speaking on behalf of, I think, the Pfizer vaccine. the way in which those are the Pfizer and the Moderna vaccine, the way in which those were created are not dissimilar to how they've been made in the past. So as far as, flu vaccines to things to that effect. So there's really not a lot of brand new material or new ingredients. The Pfizer website lists the ingredients of their vaccine in its entirety. This isn't anything that's brand spanking new. So I think the long-term effects, although, again, we can't predict it, and that's why they have clinical trials. And unfortunately, we weren't able to get the long-term effects based on clinical trials. But again, they did go a little bit further than they typically do. Typically they monitor for 6 weeks. In this case, I think they went 8 weeks. Don't quote me on that. But the long-term, years down the road, we're not going to know. But at the same time, it models pretty much other vaccines. So I think that they will be similar responses. I think if I could.
I like how you say, don't quote me on that, but you're live TV. Hey, but driving in today, the good news. Yeah, there you go. The good news coming out though is about the Johnson & Johnson vaccine. It looks like they are going to get the emergency approval. I will say, I think this is going to go a long way into the vaccination efforts, because I'm waiting for that. I only want one poke in the arm. Plus, I feel more secure knowing that it doesn't require those extreme refrigeration efforts, because let's just say I don't really trust the whole process, right? That it stayed in these freezing cold temperatures from point A to point C and D before it gets in my arm, and then I got to go back for 2 pokes versus 1.
Yeah, and anytime you have more than one injection, then you're automatically increasing the risk of things that could possibly go, not according to plan. However, they've had a pretty successful rollout so far of the ones that people that have gotten injections. The Johnson & Johnson vaccine, I'm excited about it too, because more likely will be the ones that places like mine, I'm a small business, and my office does not have the capacity to have that sub-zero freezer to get the delivery to keep those vaccines, and have you come back for the second poke. We just don't have the capacity to do that. But these vaccines, which are stable at much warmer temps than the extreme cold that the other vaccines require, will be allowable for someone like me to be able to have it. So a lot of patients were getting frustrated because we didn't have the vaccine. Certainly we don't have them yet for the general public, but now that the Johnson & Johnson vaccines are out, those will be the ones that are likely to be more in the offices.
But I will say too, I trust my doctor. Like if I go to him often or she often, I trust you. Like I'm going to feel much more comfortable going to you than a vaccination drive-through clinic, or at least listening to your advice. But with that, I do wish that about 30 seconds left here on the show. I had a fortune teller, and I would have made a bet because you called it way back months ago. We were going to have very few flu cases this year due to the precautions that everyone was taking, and that has turned out to be true.
I'm right for once. Thanks. I think I'm glad. I mean, if there's anything that's been positive out of that, I think we've proven that, social distancing, hand washing precautions are real and that they did help. I think that's been proven. I think there's also, again, the other fact that there's been lower flu cases is also because a lot of patients that come to me with flu-like symptoms, they just want to know if they have COVID. And once I test them and they're negative, they go, all right, I'll see you. And then they're out the door, and I never tested them for the flu. They just feel better about the fact they don't have COVID and they're gone. So I think that should be something we should also consider doing. And I think people are also getting the flu vaccines as well. So it was a boom year for a lot of people wanted the flu shots.
Well, and with that is a good year or a good note to leave us on. Stay safe, stay healthy, and they are doing that in part because of people such as yourself taking your time to share with us all of your valuable information. Dr. Jamie Taweel with us here on the MegaCast from the Grand River Medical Associates.